Hi, I'm Madison Stein, NeuroStim TMS's resident clinical operations specialist, here to bust some common myths and misconceptions about TMS therapy. So you've gathered all of this information about TMS and it's still sounding too good to be true. So you might ask, well, what are the actual side effects? One thing that I like to say without sounding too salesy to people is the biggest side effect I see is that people feel better, which is a really incredible side effect to have. So in some ways, it does still sound too good to be true, and that is totally okay. The biggest side effect that I tend to hear is localized headache or spot tenderness. And by spot tenderness, I mean the treatment location itself. This occurs in about 15% of our patients and is usually well managed by Tylenol or Advil as advised by our TMS provider. This is because the magnetic pulse does create a sensation on the scalp. Some interpret this as easy as a scalp massage, whereas others it can be a little bit more painful. Our trained TMS technicians work with you to make sure that we're moving at a comfortable pace that is still efficacious for you. Another side effect that I commonly see is sometimes people report either an increase in energy or a decrease in energy. I always like to tell new patients that there are 3 types of people when beginning TMS. The first, they get an increase of energy, and the second, they feel like they could kind of go home and take a nap. The last, nothing happens, and all of them are totally okay and have no bearing on the efficacy of treatment itself. These highs and lows that individuals might experience in terms of their energy typically only last the first week or so because we're kind of in there shaking the tree a little bit. The last side effect that I like to note, although very rare, is a small chance of seizure. This occurs in about 1 in 50,000 treatments. This is actually less than the chance of getting struck by lightning, which is about 1 in 15,000. In clinical trials of over 10,000 TMS treatments, no seizures were actually observed. It's also important to note that although there is a small risk during TMS treatment, the odds are actually less than those of antidepressant medications or other household medications that you typically take without question. Most seizures in a clinical setting are due to the fact that patients may not disclose other underlying drug and alcohol issues or seizure disorders that might already be present. At NeuroStim TMS, safety of our patients is of the utmost importance, and we want to make sure that we're doing all that we can to make you feel the most comfortable. We are proud to say that we have never had any seizures out of any of our locations. However, we still make sure that we're providing clinical excellence, and all of our team members are certified in CPR and seizure training. If following this video you still have concerns around the safety of TMS, please give one of our 7 Puget Sound locations a phone call, and we'd be happy to answer any sort of questions that you might have surrounding safety.